So today, the government of Saskatchewan is announcing a number of aggressive new measures to prevent the spread of COVID-19 in our province. The Chief Medical Health Officer of Saskatchewan has made the following order pursuant to Section 45 of the Public Health Act, and it will be effective Monday, March the 16th. The Chief Medical Health Officer orders that no public gathering of over 250 people in any one room should take place. This does not include settings where people are distributed into multiple rooms, multiple buildings, such as schools, universities, or workplaces. The Chief Medical Health Officer's orders that no events with over 50 people, with speakers or attendees who have traveled internationally in the last 14 days should take place. Retail locations and faith-based organizations are exempt. However, they should also have measures such as crowd size monitoring that support the safe social distancing that we have discussed, and should seek guidelines from both local medical health, local medical health officer if they feel necessary. And effective immediately, people who have traveled outside of the province in the previous 14 days or who do have symptoms of acute respiratory or flu-like symptoms should avoid visiting long-term care homes and hospitals. In addition to this, the government of Saskatchewan, as an employer, is imposing a number of policies regarding government employee travel. So effective immediately, international travel, including travel to the United States of America, for government employees on government business has been prohibited. Any out-of-province travel for government employees on government business within Canada will be restricted and is subject to the approval of the Deputy Minister to the Premier. Any government employees who are currently traveling internationally, including to the USA, or plan to travel internationally for personal reasons, they will be required to self-isolate for 14 days after returning to Canada. This is a precaution. If they have or they develop any acute respiratory or flu-like symptoms, they should contact 811. All government employees who are experiencing symptoms of an acute respiratory or flu-like illness will be required to stay at home or to contact 811. While these measures are being implemented as a policy for the government of Saskatchewan ministries, the crowns, and the agencies, the Chief Medical Health Officer strongly recommends that all employers and individuals across the province follow these practices. This will help us limit the spread of COVID-19 in Saskatchewan. It will help to protect residents from exposure to the virus, and it will reduce the impact of COVID-19 on our healthcare system, essentially flattening the curve. In keeping with these new policies, Budget Day events on Wednesday, March the 18th, they will proceed, but they will proceed without the participation of invited guests. This decision was made after discussions with the Speaker of the Legislative Assembly. Members of the Legislative Assembly, media, and a limited number of staff will be authorized to gather for these events while also practicing social distancing. Further, after consulting with the Speaker of the Legislative Assembly, it's been decided that all tours and all public events at the Legislative Building are being suspended, and general public access to the Legislative Building is also being suspended. Our government is also taking measures to increase our capacity to handle COVID-19 in Saskatchewan. Concerns regarding the capacity of the health line 811 have been heard. Following an action plan ordered by the Minister of Health, the capacity of the health line, the 811 health line, has been more than doubled, effective as 9 o'clock a.m. this morning, with additional capacity that will be being added in the very near future. The Ministry of Health and the Saskatchewan Health Authority continue to work together to expand testing capacity for COVID-19, and that includes the introduction of a COVID-19 assessment sites across the province over the coming days. While these are significant steps that will help limit the transmission of COVID-19, most important is the responsibility that we all have to ensure that we do what we can to reduce the risk to ourselves, reduce the risk to our families, and reduce the risk to our communities. And the best way that we can do this is to practice social distancing, to wash our hands and wash our hands often, to avoid close personal contact like handshakes or hugs, and to self-isolate if we feel any symptoms of illness.